Hello, everyone. Welcome to COVID-19 in Cities Supporting Aging Populations. My name is Katharine Lusk. I co-lead the Boston University Initiative on Cities. For those of us joining us for the first time, I see someone from the Philippines. For those folks joining us for the first time, we are a university-wide research center housed within Boston University. We catalyze and advance urban research. We have a particular focus on studying mayoral leadership. We also serve as a hub for all urbanists across Boston University. So we work with all of our faculty and students that have an interest in cities and urban populations. And lastly, we forge ties between outside networks, outside cities, and other partners and our own BU community. I see someone else tuning in from Tampa, Florida. Again, welcome. So this is the, I think, fourth or fifth session in our series that we have put together on COVID-19 in cities. And what we wanted to do was to sort of delve deeper into some of the populations and some of the issues that are emerging as a result of the COVID-19 crisis, and feature some of the research and expertise across Boston University. So far, we have delved into the fiscal crisis that's confronting cities, other issues around transportation, how cities are going to better support their small business community. And today we're here to talk with Antron Watson and Bronwyn Keefe about how cities can best support aging populations in the time of COVID. Just a quick reminder for folks, there will be a Q&A session. I'm going to introduce Bronwyn and Antron. I'm going to let both of them present and speak, and then I'll field a couple questions. And for those of you who want to tune in with your own questions, please submit them in the Q&A function, and I'll be reading through and synthesizing those and fielding those questions on your behalf to Bronwyn and Antron. David Gross is also here with me from our team, and he can remind me if I've forgotten anything important. And with that, I will get started. I'm going to open up so that I can share Bronwyn's bio. And then I will also introduce Antron, and then Bronwyn, I'll turn it over to you to take it away. So Bronwyn Keefe is joining us. She is a research assistant professor at the Boston University School of Social Work and serves as director of the Center for Aging and Disability Education and Research, CADER, and professional education programs here at BU. Dr. Keefe has extensive experience developing curriculum and evaluating training initiatives for professionals who work with older adults and people with disabilities. And through her leadership, CADER has trained over 20,000 workers and worked with more than 450 community-based agencies and state organizations across the country, providing online training in the area of aging. Antron Watson is currently working with 70 cities and towns across Massachusetts who have committed to make their communities more livable for people of all ages. He serves as the age-friendly director for AARP Massachusetts, where he works to engage and mobilize communities, share expertise, and deliver technical assistance to the towns, cities, and counties in the AARP network of age-friendly communities, including Boston. Watson is an experienced social services and community advocate with a demonstrated history of working in the nonprofit sector, and his interests include leveraging government and research to improve community outreach and volunteer management. We are so pleased that we know Bronwyn and Antron, and we are really delighted to have this incredibly important conversation happening today. With that, I'm going to turn it over to Bronwyn and let you start off the conversation.
Great, thank you, Katharine. Hi, again, my name is Bronwyn. Good afternoon. Happy to be here. So I just wanted to sort of set the stage for what I'm planning on covering in my portion, and then Antron's is going to sort of build off what I start with, and hopefully it'll be a really comprehensive, cohesive experience for you folks on the webinar. So I'm going to go through and talk a little bit about what are some of the unique challenges for older adults, who supports older adults, both at the national and state and local level, and how have these organizations responded to older adults' needs during the time of COVID-19. And also, I'm going to touch on some of the work that I do that I think is really going to be becoming even more critical in the importance of training, and in particular in the area of behavioral health and mitigating social isolation in older adults and their families. So the next slide, please. So as Katharine mentioned, I'm the director of the Center for Aging at Disability Education and Research, known as CADER, at Boston University School of Social Work, along with a research assistant professor there. And this center was funded originally in 2002 by Atlantic Philanthropies. And since then, we have been funded through other grants and state and local contracts across the country. And really, the goal of CADER is to strengthen the workforce who work with older adults, who are providing health and long-term service supports to older adults across the country and even across the globe. So I'm glad, I think I saw somebody here that might have been from Africa. We have just finished a pilot in Rwanda. So we do a lot of training through online. That's our medium. So we create the training, we deliver it, and we evaluate it, and all to really build the competencies of the workforce that is working day in and day out with older adults to support their needs. So the next slide, please. So I think it's important to talk about some of the unique challenges for older adults and why and how this could be impacting them differently or a little bit more starkly in the time of COVID-19. So depression is one of the most common mental health issues that older adults face. And in the United States, about 20% of older adults report being depressed. And in Massachusetts, it's a rate of about 30%. And in some communities in Massachusetts, it's almost as high as 50%. And for example, for the folks that are local to Massachusetts and have been following the pandemic, Chelsea, which is one of the cities that has been hit the hardest in Massachusetts during this time of COVID-19, has a rate of almost 50% of folks that are diagnosed with depression. Next slide, please. Also, what's important to consider is some of the other challenges around social isolation. So there's been a lot of really important research that have come out recently about what social isolation can do to older adults and the impact that has on them. And in fact, what this research has shown is that social isolation can lead to increased risks of heart disease, equivalent, I think, I read one of the research articles of 15 cigarettes a day. So really having negative health outcomes, and also depression and anxiety, and greater uses of hospitalization and emergency rooms. So we already went into this pandemic becoming very aware of what the impacts of social isolation is for older adults. And this pandemic has just amplified that. So we are upending social connections for all of us. And physical and social distancing is leaving many of us feeling isolated and lonely. We've lost a lot of our supports, senior centers where older adults go, places of worship, local businesses, all of these have no longer been available. And while it's really critical to social distance and physical distance during this time, it's really set in a very prolonged period of loneliness and isolation for older adults, for all of us, but in particular, a population that was already vulnerable to social isolation. So next slide, please. So some of the sort of unique risk factors for social isolation among older adults really is around, and I think Antron will speak to sort of this in an age-friendly lens, around transportation, around poor health and well-being, societal barriers, lack of access, and equality. And again, these inequalities have really been amplified during this time. So when we think about some of the ways in which we've all been trying to become connected and stay connected is through video chat and online technology, FaceTime, Zoom, like we're doing right now. And this has really been an important way geographically for all of us to stay connected. But for those that don't have a computer, that don't have access to broadband, they're really left out of the loop of this. And further, low-income adults who may live in smaller apartments or live with children or grandchildren, they are also at greater risk because they may have family members that are now considered essential workers who are going out to the grocery stores or going to nursing homes where they work and are more at risk now for bringing the virus back home to them. So there are many, many challenges to consider when we think about risk factors and unique challenges for older adults. Although there are many organizations that are really working to try to keep people connected and active. And there are ways that people have tried to think about doing this with and without technology. Next slide, please. So just, you know, the aging network is so layered and complicated, and I know that the audience here can sometimes be a diverse group of folks, some who really know the aging field and some who may not. So just sort of a quick overview to say who supports older adults, I think might be a little bit helpful. And then, as I said, Antron's really going to get into some community examples here in Massachusetts, but I think it's always helpful to sort of start from that beginning at the national level. So we have national organizations, we have statewide organizations that are really doing the hard work of supporting older adults. At the national level, we have the Administration for Community Living, which is one of them, falls under the Department of Health and Human Services. And they are the ones that are really putting out a lot of different mechanisms to increase funding, research for COVID-19. They've been instrumental in the work that's been put out there through the CARES Act and through the HEROES Act. So really making sure that we are represented at the federal level. There are also organizations that do a lot of sort of lobbying for their own needs, and they're usually membership organizations. So again, at the national level, there's the National Associations for Area Agencies on Aging, and there's the National Council for Older Americans, both of which are membership organizations. At the statewide level and at the community-based level, the main organizations that older adults will interact with at the community-based levels are the area agencies on aging. And in Massachusetts, we call them area service access points. So they're AAAs known across the country, but ASAPs here in Massachusetts, just to make it a little bit more confusing if you could go through all the jargon. And then senior centers. Senior centers are really the go-to place. I mean, those are the councils on aging where people will go and maybe have a meal with friends that they've met, maybe do an exercise class. It's really that place. It's the hub. It's the go-to place where a lot of folks in the community go to. And so across the country, there are about 11,000 senior centers, and there are about 622 AAAs or ASAPs, as we call them in Massachusetts, across the country. And they're really doing the important on-the-ground level work where their funding comes down from the national organizations, but they're on the ground doing the work. Also at the state level here, we have the Executive Office for Elder Affairs, which has been doing a lot of really important work pivoting towards COVID-19, and I'll speak a little bit to that in a moment. And then I think it's also really important to think about our faith-based organizations. More and more older adults do tend to turn to clergy during times of stress and need and support, and so they're a really important resource for our community. And then, of course, advocacy groups, and I'll speak a little bit about some of the advocacy work that I've been involved in, and of course, family and caregivers. So there's a whole network of people who are supporting older adults across the country. Next slide, please. So just in terms of like an overarching view of sort of how we've responded to COVID-19, and this is really, these points I think have been really important in terms of thinking about how people can socialize, explore, unwind, and connect. How, again, feeling this idea of how do we keep people socially connected, how do we mitigate social isolation, and keep people healthy in their homes. So the federal agencies have done a lot of sort of toolkits and fact sheets, and there's a plethora of information out. So if anybody is interested and doesn't live in Massachusetts, if they just did a search on ACL's response to COVID-19 or NCOAs or N4As, you would get a whole list of wonderful, wonderful resources that you can call upon. So they've given some tips on how people can stay connected during this time with technology. And again, it's thinking about, Facebook and Skype. There's also ways to sort of continue to exercise our brain and our mind through courses that are now free through edX, zoos and museums. They're all doing sort of virtual tours. Again, this is a certain audience we're speaking of that is able to have this type of access to technology, but it is all now free. So it's available. It may not be the same as walking through the museum, but you can go through and through Google Arts and Culture and see a lot of these wonderful works. And then in terms of technology, it's really interesting because it's really kind of going back to old school. It's pick up the phone. it's call people. So a lot of the responses to COVID have been phone calling. Write a letter, write a note, you know, draw a picture for somebody who's at home and it doesn't have any contact with people. And there are many ways that people can get involved, if not with your own family, but also involved with supporting other older adults in the community that may not have anybody. Next slide, please. So in terms of here in Massachusetts, just some of the things that at the state level that they have done, and this is really coming again through the Executive Office of Elder Affairs, they have set up a couple of new responses. So right now we have a nursing home family resource line, obviously in response to some of the really horrific stories that have come out about deaths in nursing homes, and in particular here in Holyoke at the Soldiers Field home. So, you know, they are now trying to respond to this by having a dedicated telephone line that will connect residents and members of the family together with resources. It's something that is staffed, I think, 9 to 5, not all hours, but it is a phone line that you can at least get to immediately. A lot of the services that are provided by senior centers and by the AAAs that would be going out into the community to do companion visits or have consultations or counseling. They are now doing those telephonically. So it's not just telehealth, it's really telephonic support also. So people will call up and check in on them. They've also are doing wellness checks. So that's another kind of just people. But, you know, I was on the phone with somebody who runs a senior center, and she acknowledged that didn't even have phone numbers of half the people that go there. So, you know, there's been this whole big thing of like, how do I find the phone numbers? How am I going to reach this person? Sort of snowball, you know, technique. Oh, do you know this person used to come and sit with you at the table all the time, or did, you know, Zumba with you? Could you help me get the phone number so we can check in on them? So it's really been a lot of this sort of grassroots efforts on how to reach people. Volunteers, people have really been coming out in droves to help volunteer and delivering meals and groceries. Again, Antron's really going to dig into some of these specific examples here in the state. Also, EOEA has created, as they did at the federal level, a lot of online tools and resources. So if you're here locally, again, I would go to that website and see what available resources and tools are there. And then they also, again, this issue of social isolation, they're having now bi-weekly roundtables with the Executive Office of Elder Affairs, Department of Mental Health, and Department of Public Health around social isolation. And I know Antron's going to action plan, but we are the second age-friendly state. And New York was first, sorry, but we're second, so that rivalry continues. And so they have this wonderful report that has been put forward, but you know, now they're going to pivot this a bit on response to how things are different and how things have changed now that we're in this time of this pandemic and hopefully getting towards a post time. So Antron, I know, will speak to some of the changes coming there. Next slide. So this is just in general for all of us, suggestions around mental wellness. We need to connect with our loved ones. We need to limit our news consumption, care for things, pets, you know, plants. Try to find something at home that you can take care of. Take care of yourself. Find activities that bring you joy. All of these are ways around that we can do in our own home. Again, it's always best if you have support and people are sort of doing this with you and saying, come on, let's, you know, do a game together virtually or whatever it may be. But these are the ways in which to do. And then, you know, I know we all spend time visiting our loved ones at our 6 feet distance. So I think that's another way that we continue to try to stay connected if people are close by. Next slide. So I just want to take a few minutes before my time is up and just quickly talk a little bit about what I think the workforce can do, because that's really my area, is in training and developing the competencies of the workforce. And I think some of the work that we've been doing will just continue to be really important. One of the important findings that we know is that one of the biggest barriers to mental health services and to access is a lack of a trained workforce being able to identify that there are concerns here. So unrecognized and undiagnosed mental health treatment, it can really be costly and obviously lethal to the person. So, so we really have, we have a series of 5 online courses that are really focused on key areas that we think all folks should know. And I'm just going to describe a couple of different initiatives that we have that I think are going to continue to be important. So senior center training, as I mentioned, they are the front gate. They are the front door. People come in there all the time. And a lot of those folks are usually people who may not have a clinical background. They have varied backgrounds. And so they may not be well equipped to identify mental health concerns. So we have been working with senior centers in Massachusetts through funding through the Department of Public Health, and senior centers in Illinois and Florida. I think I saw a Florida person on the chat, and now in Wisconsin. And this is funded through the Retirement Research Foundation grant, where we are building the competencies of their workforce in the training. And we've been doing some analysis on this, and really what's been very interesting is to find that increasing their knowledge has really helped them to learn how to engage older adults better, so that when people would come into the senior center and maybe exhibiting signs of resistance to engaging in groups or behavior that would be considered disruptive, oftentimes they were written up as critical incidents reports, and people were sort of saying they were problematic. And since taking the training, these critical incidents reports have been declining, and people are thinking of new ways on how to reach older adults where they are and engage them. So I think that's really been some important work. And we've done similar work with the AAAs and the ASAPs across the country in our work. Faith-based training, this is also a grant that I have through the Department of Public Health, where we're training faith leaders in the same area, which has also been very interesting, because as I mentioned, folks go to to their faith leaders in times of stress, and they've been, really cut off from this access to them. And when things do start to open up and they are able to go back to their places of worship, I think there's going to be an influx of folks that are really have been, gone through a lot of trauma. And the clergy have really found that understanding this has been very empowering. Another initiative has been work that I've been doing here with medical students at Boston School of Medicine, where we've been training interprofessionally and mental health training. And they had to switch everything to telehealth, and they've been doing social calls now. And again, this issue of people that just don't have anybody coming into their homes now. Their direct care workers are not coming in, visitors aren't coming in, and what this means. And then age-friendly initiative in New Bedford, which I think I'm going to leave all the age-friendly aspect to Antron, because I don't want to take up too much more time. But that was really an approach to really look at some anti-stigma work around mental health, and provide some workshops for older adults, and then training in the community. So next slide. So what can we all do as members in our communities? So we can check on the people who live alone. We can connect with our community-based organizations. We can volunteer. I think getting involved in advocacy efforts is really important too. I mean, we all, regardless of what our background is, I think advocacy and volunteerism is an important time in our lives to think about how we can do this creatively. And again, there are many different places where they have lists on how people can get engaged. But when you think about advocacy, we must be thinking about this through a social justice lens. And again, the inequities of society that have really been highlighted during this pandemic, and thinking about communities, folks that live in nursing homes, communities that have economic and environmental inequities. All of this is just being amplified, and there are ways that we can get involved in advocacy. I'm part of a Massachusetts Aging and Mental Health Coalition, where we get together once a month with leaders from across the states, talk about different ways where we want to advocate for mental health issues among older adults. And we've been able, as a coalition, to really make some changes, not only just in the budget in terms of there being line items now for funding for elder mental health, but also in sort of more smaller areas in terms of really lobbying and calling our legislature and getting involved. So it's been a great opportunity for me, both professionally and personally. And then the last slide, I really just wanted to put this out here for everybody, because these these are our resources, right? So again, knowing that you're all over the country and that these are the places that you might want to think about. So you've got your elder care locator, which is where you can find a AAA in your community. You've got NCOA's website, which is about where your senior centers are. But again, there's just an enormous amount of information around COVID-19 responses. I like the website here on Daily Caring and Senior Planet because they gave some different creative suggestions around low-cost internet options and other ways that you can bring things together. Also, some AAAs are providing computers, so there are possibilities. It's worth it to reach out and see if there are loaners or things that people can use to be connected. And then the YMCA also doing virtual classes. So I think there are a lot of different, but it's definitely taking a creative effort, which I think has really been an interesting blend of new technology and sort of, as I said, old school, like getting back to letter writing and calling and doing as much that we can to keep people connected during this time. So I think I will turn it over to Antron, who will talk a little bit more about the specific examples of how communities here in Massachusetts have done some other really creative and enlightening efforts. Thank you.
And I'll just say thank you so much to Bronwyn before we turn it over to Antron. For those folks who've asked about the slides, with their permission, we'll be posting them on our website in short order so that you can also get access to those hyperlinks. Antron, over to you.
Well, thank you so much, Bronwyn. You brought a lot of good information, really hitting on the national level and bringing it kind of down to the state. And that's really where I'm going to pick up, is really on the local level, with where or how communities are reacting and how they're supporting their residents, primarily their older residents. The next slide, please. When you think about age-friendly, or when we say age-friendly with AARP, AARP being an advocacy organization, really working with cities and towns and the older residents across the country to really, help create local leaders to advocate for the needs of those seniors or your older residents, and really create communities that are more livable for everyone. So really, when we say that, we're saying, a healthy community is one that has policies, systems, and services and products and technologies that are in place that really promote health, build and maintain physical and mental capacity across the life course, and really enable people to experience the life they choose to live in their community or where they choose to live. Next slide, please. So when we look at that, so when we talk about age-friendly communities, we really look at these 8 domains of livability, which focus on various areas. And these 8 domains really came from the World Health Organization, who has polled several people to really say, what is it that you need to live in a community to the best of your ability? We talk about community support and health services, your outdoor spaces, so that's your parks, your libraries, your buildings that we always go to, your transportation, and that includes not only driving but bicycles, your walking, and how can you get to and from places best as possible. Housing, social participation, respect, social inclusion, civic participation, and then communication. Obviously, all meeting the basic needs. If you think about your own community, what are the things that you love about it, and why you chose to live there? And more likely than not, I'd say majority of those things would fall within these 8 categories. Next slide, please. So when we think about how things were going prior to the pandemic starting, a lot of the communities that have committed to becoming age-friendly or being age-friendly, we're looking at housing. So how can we address housing in our areas? Working to develop a variety of housing options, including multifamily housing options, and really looking at the accessory dwelling unit aspect of things. Additionally, we're looking at transportation, really increasing that access and connectivity to public transportation. A lot of communities that do have public transportation, it extends but so far. You think about Boston, with the T. It goes to the local T, the blue line, the red line, the orange line, lines, whatnot. They reach out to a certain extent, but then the folks after that live just beyond those lines have to find their own ways to connect to that transportation. And how are communities doing that? Some were looking at bicycle lanes, really connecting bicycle transportation to the major hubs where people can catch the subways in and out of Boston. Another area that really kind of hits home is your parks and your public spaces. Places we love to socialize. People were adding, cities and towns were adding exercise equipment to really engage their seniors who wanted to get out of their home and stay active, really creating walking trails that lead them to outdoor exercise equipment. Placing park benches to encourage people to really get out of their homes and just enjoy one another, enjoy their communities, have somewhere to sit, be it at a bus stop or just in the neighborhood to have a conversation and just enjoy the sights and sounds of where you live and the reason why you chose to live there. So that's where communities were, we'll say back in March prior to this pandemic really starting. Next slide, please. So now we look at where we are now. A lot of what we've been hearing from communities is around communication. Really, how are residents getting the information they need as the times continue to go forward? Where can they find support? Primarily meals. That's probably top two is meals and communication. Where can I get food? How can I get food? And when can I get back to a normal way of life? And social participation, as Bronwyn said. Really, how can I stay connected when I can't leave my home? We all kind of sometimes take the internet for granted. There are communities that don't have internet. And actually, back up to communications, there are parts of the state here in Massachusetts that weren't actually able to hear the governor's daily news conferences. They were actually getting the news conferences from the neighboring state, which would happen to be New York, which isn't very helpful, right? So next slide. So we think about, how are communities responding? So really, some examples here of how communities are connecting or connecting with other organizations in their areas. For example, here in Barnstable, the Council on Aging really connected with the local school district there to provide messages of hope, artwork. So really connecting with the children who had just were sent home from school and now had to figure out their school work and providing opportunities for those children to participate as well by creating artwork and bringing it to the Council on Aging, where actually they were scanning the photos and the Council on Aging was printing them out to include in the meals services that they were sending across the region there. Additionally, they are expanding this program, and this is not only in Barnstable, but other parts of the state or cities were looking at this same kind of idea. Next slide. When we talk about communications, another local town here in Chelmsford, they really took the collaboration to a different level. Thinking about how do we get information into people's hands who don't have internet, but maybe have a television. So really connecting with the local access to bring information to residents, to answer those frequently asked questions, really reaching beyond your email, right, and providing information. So the director at the business administration down in Chelmsford connected with the local cable access, health services individual, a couple folks from the school districts to really provide that information to residents kind of on a weekly basis. And as a result, if you weren't able to catch the cable, the channel, the live feed, you could also see it on YouTube at a later time, right? Again, finding ways to connect to people as best as possible. And, as Bronwyn mentioned earlier, phone calls. Really getting back to the basics of providing phone calls. Next slide, please. And that takes me to Boston, who really has a robust plan and was able to establish a call center staffed with several volunteers to really take calls from the residents of the city to answer their questions, point them in the right direction for food research, food referrals, mainly Meals on Wheels, adding folks to a grocery delivery list for those who could not actually get to and from stores to get the needs to maintain their well-being. and really helping navigate the challenges. Really understanding what the mortgage and rent relief programs were all about and how to apply for them. Again, connecting, understanding insurance and access to medication when you're being told to stay home and socially distance. How can I still get the information, what I need to maintain my well-being? Again, connecting to other services and simply taking residents in another organization, the partnership that came through with Boston was with Nesterly, which was a housing placement program that was established, really that paired your graduate students with older residents in the city who had space available for people to live, be it for a semester or slightly longer. But really creating that intergenerational synergy to really deter social isolation that was taking place throughout the city. And actually, and this is actually a photo from New Bedford, where first responders have actually been assisting with taking meals, bringing out meals and food to residents in need. Next slide, please. And then you think about, what's next? How do we move forward? Who's really involved in all these efforts? AARP has really been listening to what communities are saying, and a lot of these things reflect what is happening here in Massachusetts as well. So when we think of respect and social inclusion, we're looking at, what can communities do to provide those opportunities? Is it the pop-up drive-in theater to really get people out of their home but still staying safe in their car to enjoy a community event? Transportation, providing the needs for those folks that need to get to doctor's appointments still when they are in place, and providing that services to expand the reach, be it your internet access, communication skills, and again, as Bronwyn mentioned, some of the Council on Aging's providing tablets or communications devices and training to allow people to stay connected. All of these things really help to deter kind of the impact of social isolation. I think if you look across the 8 domains, each one in some way, if not being met, may lead to some very severe health and mental health, general health and mental health decline, right? And we want to avoid that. So it's nice to see communities responding here in Massachusetts to meet these needs and coming up with a lot of ideas and best practices to really deter and find a way forward for us here across the country. Next slide, please. And you think about so what's next? Really, to learn more, you can always visit aarp.org/livable to see what communities are doing, not only here in Massachusetts, but across the country. I believe they're putting some information up there today or tomorrow that really will highlight some of the things taking place across the country, how communities are responding, and how we're meeting the needs of our older adults. And what we always say here at AARP is if we're meeting the needs of our oldest residents, we're going to meet the needs of everybody else down to your youngest residents. Mm-hmm. All right. Mm-hmm. Another thing that we'd like to say is how can you get involved? Once the pandemic really started, AARP did pull together a mutual aid site to really have a place for people to go and find out what's happening in my community if I can't find it on the city or town's page. Maybe there are other groups that are working together. So providing that opportunity for people to really get together and join into the efforts that are happening as to not duplicate the work that's being done, which is sometimes happens, and let's really collectively join together to make a bigger impact on the needs that are being addressed or brought to our attention. And then lastly, obviously if there's questions, that's my email address. And I believe that's it for my slides.
Great, thank you so much. Do you mind, David, do you mind backing up for us? Well, actually, for a reminder to folks, use the Q&A function. I'm gonna start us off with a couple questions, but use the Q&A function below if you have a question for Antron or Bronwyn. And then you can also vote on those questions if you want them to sort of rise higher in the queue and make sure that I do get a chance to pose them. But David, I'm wondering if you can back up a couple slides, because I think this was a really helpful resource, I think, for a lot of communities, because there's a lot of recommendations in here from you, Antron, that particularly because we have a very international crowd who has tuned into this session, it feels as though there's a lot of recommendations in here that are universally applicable. So I'm going to start here if people want to lean in and read it. But it sounds like this resource is available on the AARP website, so folks can also go to it and download it from there. So the first question I wanted to pose to you is actually about housing, and in particular, sort of how, where, and with whom our elderly and aging residents live. And it feels, you know, we're in a time of crisis, and I'm curious if you have yet started to see innovation or new ideas emerge from that crisis that relate to housing, because assisted living facilities have been so hard hit by this crisis, and our elderly residents have been so hard hit, whether they are in good health but severely socially isolated, and in good physical health but poor mental health, or are in a facility where they are perhaps both have been compromised. And I want to sort of draw a connection between those things and housing, and sort of our cultural expectations and the existing infrastructure that exists in our cities about, again, about sort of how, where, and with whom elderly and aging residents live. And I'm curious if either of you have a perspective, if you're yet seeing new models emerge, new ideas emerge, new types of conversations emerge, or even fresh urgency around new forms of housing emerge. Antron, do you want to start?
Yeah, definitely. So what we've seen is really kind of tying back to the whole housing diversity, really allowing for accessory dwelling units, especially for families who don't live near their older adults. So, you know, extended families, really bringing those adults who may need a little more care, or it'd be nice to have them closer during times of need like this. I was actually on a call earlier today where some folks down on the Cape were saying that a lot of their seniors that they would reach out to actually weren't there because they went to go stay with relative extended family somewhere else, be it in their main dwelling or an accessory dwelling unit. Oftentimes is why communities are putting in those ordinance changes or code changes to allow for accessory dwelling units to be built and sustained in a community. So to allow for this type of situation, or just for the fact of I'd love for my parent to live with me as they continue to age and maybe have more needs. I'm there and can serve those needs for them.
Right. Right. And for those who don't know and haven't heard of an ADU or an accessory dwelling unit, it's an additional unit that has to be permitted to be built sort of in the context of let's say a single family home. So some countries might refer to it as like a granny flat. But in our city, in Boston, and in many cities around the country, they're actually illegal. You can't use, say, a portion of your backyard to build an accessory dwelling that someone then inhabits. So it requires zoning changes in order to make those types of units permissible. So just a little clarifying language for folks in case you weren't familiar with the term. Bronwyn, any thoughts from you on the future of housing for elderly and aging?
I mean, Antron mentioned Nesterly, which I think is a really fabulous program that's now here in Boston, and they're really they're doing a lot of outreach to universities. BU in particular, I've had a couple of conversations with them, and I think it's something that's going to get a lot of momentum because it's really it's filling this need. There are so many students that are going to these urban schools where they can't find decent housing, and then you've got somebody who may be living in a bigger home or even with an extra room in their apartment. And this idea of bringing the generations together, and it fits a need where somebody can be there, and they have many different models. Some are, you pay a certain amount of money. Some is, you have some responsibilities where maybe you walk the dog or you do some light housekeeping, and they're all different sort of share models and pricing models. And I think it's just really bringing the best of all of this together. It's bringing young people around older adults, helping to cut down that stigma of older adults may not be contributing members of society, but now you're living with one and you're realizing all the gifts. I've had a couple of students that have done this in Brookline with an older woman, and they have been so so enriched by that experience. So it's really a wonderful way, I think, to be creative about solutions for housing in the city.
Mm-hmm, mm-hmm. And Antron, we have a question about thoughts on communities and societies who allow elder and senior citizens to work. But I want to ask you that question, but I actually want to ask you a slightly different sort of shift on it, which is, what are some of the ways that you're seeing communities sort of enable their elderly and aging residents to still earn a living, but to potentially also put policies in place that are designed to protect their health and well-being?
So, honestly, that's one we haven't seen yet. And not too much has bubbled up yet around that. But I think, if we, address it via the access to, internet, so being able to allow folks to work from home, like we currently are, and really, if some of our older adults who don't have those connections, making sure that those connections are in place in communities would make it available, make it more feasible and possible for initiatives like that to take place. But unfortunately, I don't have a real answer on that one yet.
Yeah.
I'd love to see what communities are trying to do to, as we all start to transition back into being in the offices again, what does it look like for what we've identified as our most vulnerable, including our older populations.
Mm-hmm. I know I've seen some, there's been a lot of innovation in trying to help young people get access to internet, and school districts working really hard to either create new discounted plans with internet service providers, or actually some school districts are talking about they're using Wi-Fi enabled school buses and parking them in different neighborhoods at different times of day, so that the students who live in that neighborhood actually then are able to use that as literally a mobile hotspot. Are you seeing any similar innovations in communities trying to really support Wi-Fi access for elderly and aging residents?
Yes, definitely. I think a couple of communities have really, relied on their senior centers to pilot programs that are, provided them access, be it internet hubs, hotspots, or the actual communication device, so tablets or iPads to have the communication to stay connected, I should say. And then also teaching them how to communicate via social media, and have safe social media practices so that they're not being scammed either. Being able to use it for connecting to some of the services that are available, maybe the grocery delivery apps or transportation apps like Uber and Lyft, which sometimes our seniors, we don't always see them using it, but really teaching them how to utilize them, while also providing them with a tool so that they can stay connected to what's happening. The way we are all communicating now, making sure our seniors are able to communicate the same way everyone is communicating, and not treating them as an other, but as a us. We all are communicating on the same level, and we want to make sure nobody's being left out.
I'm curious if you both feel as though there's something we aren't seeing enough of yet. That there's policies and interventions and supports that are emerging, but they're not emerging either swiftly enough or at sufficient scale to have the impact that you think they need to. If you don't have an immediate answer, I'll let you think about that one and move on to the next. Yeah, go ahead.
I think that there's been a lot of important work through the CARES Act that was really to give additional funding towards programs that support older adults. I think there was actually some money even in there for home and community-based agencies around technology. I know that for me, the work that I do for around the workforce development, there was some money in there. So I think that I think there's been an interesting response more quickly around the federal level to putting some money towards this. There's also a lot of work that's been put out there in COVID-19 research. It's a long process though, right? So it's not going to be an immediate fix, but I do think that this has brought to the highlight a lot of issues that people know that they needed to react to a little bit more. And I think I think the issue of isolated older adults that are in their home and not getting access to services is one that's a really tough one that we're going to have to figure out. It was tough before this, and now it's just gotten even harder. So I think that's where I'd like to see, more sort of really important thinking and policy and money going towards that.
Yeah, I'd agree with Bronwyn. As you said, it's going to be a process. From my connection with the Executive Office of Elder Affairs, they oftentimes they don't like to do things top down. They do want to hear what's happening in community, so that whatever they do aligns with what's happening in the community, which is how their whole age-friendly plan is really set out. It's based on what they're experiencing in communities, and how can the state really take it to that next level. I think one of the big things would be communications. Is something that I'd love to see more of. How are we communicating with all of our residents equally, and having that access available, and really identifying those socially isolated that we don't know of. I think the people who come to the senior center, it's great, but what about the people who aren't coming to your senior centers? How are we reaching those pockets of people who kind of what we'd say are off the grid, right?
Yeah.
Where are they? How are they doing right now? And then how can we meet their needs if those needs aren't being met currently?
Mm-hmm, mm-hmm. It's I think one of the things that's been inspiring, tragically, but in this moment of crisis, one of the things that we've seen from city halls across the country is a much more sort of varied mix of communication channels that cities and mayors are trying to rely on, right? So they're not just saying, can I get the headline in the newspaper and use Twitter, but can I get the headline in the newspaper? Can I use Twitter? Can I be on the radio show every morning? Can I put in our neighborhood here in Boston? There's, we have small little libraries that have library, books sort of all over our neighborhood in front of people's houses, and they're sort of stocked on a volunteer basis. But now they actually have all of the city's information about COVID, and every little library anywhere in the neighborhood actually has those resources. You're seeing things in multiple languages, you're seeing them in neighborhood newspapers, which we have many of. And so I think my hope is that when we emerge from all this, that city halls realize there's many, many ways that they need to be communicating with frequency in multiple languages to reach diverse populations, and they need to be doing it all the time. I think that's a really great point. I think we have a question here I wanted to get to, which is, we have, certainly in Massachusetts, but also in some other areas of the country, we are the beneficiaries of a lot of infrastructure, of a lot of organizations. Bronwyn, you mentioned many, obviously, with Antron, AARP is a huge one in this country. Outside of the US, or even in neighborhoods and communities where there isn't that infrastructure, and there aren't even necessarily sort of community-based organizations, what are some of the best things you've seen people, just citizens, doing to better support their elderly and aging residents and neighbors?
Well, I mean, I think there's a lot of great work that's happening with community health workers and with peers, and I think, again, the faith communities. So the pilot that I just was working on in Rwanda, it was with a social worker, a pastor, community health worker, and folks that are just living in intergenerational communities that were really doing a lot of this work. So I think that, there are places that it's really grassroots, and so if you don't have those formal organizations, it really does mean you have to tap into those informal systems. And I think that, places of worship, places where people congregate, whether it's, libraries or places where people eat, or common areas, common spaces. Again, that's hard during a time of COVID, but ultimately when there's that ability, and I think that it's really just sort of trying to figure out who those grassroots folks are that are here. I don't know, Antron, do you have any other thoughts about that?
Yeah, no, I think you're right. You're spot on. It's where were we congregating before? What is our circle? And really, what's our ability? How can we contribute? Is really, what I would suggest. You think about the people who are making the mask because they had a sewing group that could no longer get together, but they're utilizing their time to create these masks for people who don't have the ability to get them, or don't have the ability to create their own. Really creating some sort of partnership, rethinking what you were doing. the circles you were in before, be it a professional group or just a neighborhood group. So I think those are the way that people can connect without having the multitude of organizations available to them.
Yeah, and I think you might have mentioned, I hope I've got it right, but the mutual aid, so they're sort of like a village network, you know, they're a group of people that come together in their community, and they'll say, I can sign up to deliver meals, or I can do this, and it's been very much, you know, you set it up in your own community, people come together. I mean, Antron, you mentioned that earlier, right? The mutual, yeah.
Correct, yeah, there's a mutual aid site where people are doing just that. You know, I can deliver meals on this day, or I have masks available, or, you know, or whatnot. Just really identifying the needs and coming together.
Yeah.
I'm gonna close with one last question, and then I'm gonna let you sort of imagine if you have final closing remarks for everyone. But I want to ask, with, you know, what what priorities you might lay at the feet of policymakers, whether it's local policymakers, state policymakers, federal policymakers. If you had sort of a couple key priorities that you would say, this is where we need your time and attention, this is where we need some financial resources to be devoted, what are a couple big things that you would put on the table for them?
I mean, you know, I can start. I'd say, you know, something to do with housing. I think that's one of the biggest, most important needs for all of us is really having that roof over our head and that security. Really, how can we support housing in general? You know, allowing for accessory dwelling unit options, or for the places where we have an abundance of seniors living, really supporting those facilities with the additional, be it funds or support they need to maintain a healthy, clean facility to avoid the spread of any sort of virus.
Yeah, I agree. And I would add to it, one of the advocacy efforts that I've been involved in here in the state of Massachusetts is with mental health outreach teams. And it's been a pilot project that the Executive Office of Elder Affairs has funded. But it's really, I think, getting more outreach, putting more money to outreach to folks that are not coming into the senior centers, that are not going through the traditional streams. And I think in particular around mental health and being able to get reimbursed for that. There's a whole issue about reimbursement for folks that are doing this work. So I think more money and effort could be put towards that.
That's great. Is there anything else you had hoped we would touch on that we have missed, that I missed? Said all you wanted to say?
Yeah.
I think you've covered it.
Great. Well, thank you both. This was a very wide-ranging and terrific conversation. I think there's a lot of resources, including websites and other helpful references within your slides. So just a reminder for folks, I don't know where you registered for the event, but our website is bu.edu/IOC. And on the homepage there, David, I believe by the end of the week, with Bronwyn and Antron's permission, if you provide it, we'll be posting slides. And then we also have a YouTube channel, and the link will be available there with this full video. We also have an upcoming event for those within the US who are interested. We have an upcoming event on opportunity zones, which are a federal investment mechanism by which new money can flow into development projects in cities. They were a pre-COVID program, but they're having a transformative effect in a number of cities across the country, particularly in economically distressed neighborhoods. And so we have an upcoming program on June 10th for those who might be interested in it. Otherwise, thank you so much to Antron. Thank you so much to Bronwyn. This was a real pleasure. This is such incredibly important work. This population has been so adversely impacted, both in the US, certainly in Boston, and around the world. And so the work that you guys are doing is so critically important, and we really thank you.
Thank you for having us.
Agreed. Thank you for having us.
Thank you.
Okay.
Bye-bye.
Bye-bye.
Bye.